Hello, myself NIKHIL HOSMANE. I am one of the second year medical student. Today I am assigned to check your blood pressure. May I know your name and age, please?
My name is Nalina. My age is 46.
Okay. Before continuing the procedure, I will be asking some questions. Please answer. Do you smoke?
No.
Do you take any alcohol or any caffeinated drinks before coming here? Did you make any exercise before 50 minutes?
No.
30 minutes? Something? Okay. Do you take any anticoagulation drugs?
No.
Okay. Please give your right hand. Please rest it for 5 minutes. In that 5 minutes, I am going to explain the procedure. Today I will take this cuff, inflate it around your right arm, and note down the systolic and diastolic blood pressure by palpating brachial and radial artery. Is that okay to you? You will feel some uncomfortable. If you feel anything, please let me know. Okay? I will continue the procedure. Before that, I have taken the right hand because there is no any fistula or any scars for palpating the brachial artery. And for the brachial artery, I will divide antecubital fossa into half. By taking the midpoint, I will be palpating the brachial artery, which I can feel here, and palpating the radial artery, which I can feel here. I am going to continue the procedure. Making sure that the cuff is not too tight by leaving 2 finger gap. Palpating the radial artery, inflating the cuff. Around 125 mm Hg, I can sense the radial artery will disappear, which I will take note as approximate systolic pressure. Deflating the cuff. Now I am going to use the stethoscope. Now I am going to again re-inflate the cuff. 20 to 30 mm Hg, more than approximate systolic blood pressure. Slowly deflating the cuff around 2 to 3 mm Hg per second. First cardiac cough sound I can hear around 125 mm Hg. Slowly deflating the cuff. And I can hear fifth cardiac cough sound around 85 mm Hg. Deflating the cuff. Removing the cuff. Your systolic blood pressure is 125 mm Hg and your diastolic blood pressure is 85 mm Hg, which completes your procedure. Thank you.
I am Rohit RAWAL, second year medicine student. May I know your name and age, please?
I am RAWAL, 18 years old.
Okay, today I will measure your blood pressure.
Okay.
Are you feel comfortable?
Yes.
Okay. Did you have coffee or smoking before coming here?
No.
Okay, put your arm on this table, please.
Okay.
Are you feel better?
Okay.
Just I am going to feel your pulse, okay?
Okay.
Okay, your blood pressure is 120 systolic and 80 diastolic mmHg. Thanks for coming here.
What's your name?
SRIVASTAVA.
How old are you?
35.
I would like to measure your blood pressure. Are you comfortable with me?
Yes.
Okay. Put your hand on the table. Your blood pressure is 100 by 70. It's normal. Thank you, sir.
Hello, this is YADLA. Today I am going to demonstrate how to measure the blood pressure. Firstly, we need to wash your hands. And we need to gather all the supplies to measure the blood pressure. And the supplies we need to measure the blood pressure is a stethoscope and a sphygmomanometer to measure the blood pressure. Let's start the procedure. Hello,
Hello, doctor.
this is Gayatri here. How are you doing today?
I am doing good, doctor.
Today I am gonna measure your blood pressure. May I know your good name, please?
Vignesh, doctor.
Okay, Ganesh. First, let me examine your arm. Your arm should be free from scars or cuts and fistula for dialysis. Yeah, fine. Did you take any caffeine or nicotine or exercises in the last 30 minutes?
No, doctor.
Okay. Did you using any medications?
No, doctor.
Okay. Please empty your bladder if needed and please don't panic. You might feel a little uncomfortable. Just relax. Just take 5 minutes break and we're gonna start our procedure. Thank you. Before measuring the blood pressure, make sure patients sit active silently on the chair with the feet on the floor and make sure that the sleeves are rolled up so that when the cuff is placed, it makes the direct contact with the skin. Please fold the sleeves. Position the arm so that the brachial artery is at the heart level. Make sure to place the cuff above 2.5 centimeters by measuring with the fingers. Starting with the palpatory method, first we need to examine the radial pulse. Simultaneously inflating and feeling the pulse. pulse stops at 110, then deflates slowly, and the systolic blood pressure is 110. Next, we gonna proceed with the auscultatory method. Before inflating again, please wait for 20 seconds. Place the bell of the stethoscope over the brachial artery to keenly hear the sounds. Start inflating again. Inflate the cuff to slowly and release the pressure. The first sound heard at 110 is systolic blood pressure, and the last diminished corticoid sound is heard at 70, that is diastolic. 70 is the diastolic and 110 is the systolic. You are done with your procedure. Thank you.
Thank you, doc.
Good morning, doctor. This is Seeman Vignesh. Now I am going to check blood pressure. Hi. I am going to check your blood pressure.
Yeah.
It is okay for you?
Yeah. Okay.
Are you comfortable with this room?
Yeah, I'm comfortable.
Yeah, okay. Let's consider the hands.
Good.
May I know your name?
Uttam Singh,
And what's your age?
21.
Do you have any habit of smoking or taking cocaine?
No.
Do you do any exercise before 1 hour ago?
No.
Yeah, okay. Do you have any allergies or taking fast medication?
No.
Yeah, okay. Take 5 minutes rest and make sure feet on the floor.
No.
Now I am going to touch your hand and move your clothes aboard. Are you comfortable with it?
Yeah, thank you.
Yeah. Now I am going to check fistula of the dialysis and scare from the brachial artery and lymphedema from the axillary lymph nodes or dissection or any other radial therapy. To avoid discomfort, and the cuff should be 12 into 23 cm or circumference. Now I am going to palpate the brachial artery and place the cuff. The cuff lower bottom should be above the 2 to 3 cm above the antecubital fossa. And now I am going to palpate the radial pulse and inflate the cuff until the radial pulse is disappear. Avoid unnecessary high pressure, so completely deflate the cuff. So wait 15 to 30 seconds. Now I am going to place the bell of stethoscope over the brachial artery. And now I am adding 30 mm mercury where the point of the radial pulse is disappeared. And slowly deflate the cuff. At the point of 2 to 3 mm mercury per second. These points give the systolic pressure. Easily deflate the cuff slowly until the sound become a muffler and disappear. The disappeared sound is give a diastolic pressure. your blood pressure under is normal. Thank you.
Thank you.
Hello everyone, this is Seeman, medical student here at University of Health. So in this video I am going to break down about the procedure how to take manual blood pressure. So we need two instruments. So first of the sphygmomanometer and second is the stethoscope.
Hi doctor.
Hello, myself Likhamara. May I know your age please?
I am 27 years old and my name is Rakesh.
Okay. So first thing, let's do sanitize. So Rakesh, can I check your blood pressure?
Yeah, you can.
First thing we require to do sleeve roll up. Palpate the brachial pulse here and to know the where to place the cup. Make sure placing the cup 2 centimeter above the brachial arteries. And now check it is too tight or too loose. So placing 2 fingers slightly in and check it. So it is not too tight or not too loose. So now palpate the radial pulse and inflate the cup. So where I feel the radial pulse disappear. I feel radial pulse here at 118 mmHg mercury. So now add 30 mmHg to inflating the second time. Before inflate the second time, we have to wait 15 to 20 seconds. So now inflating the cup, and first thing I will place here the barrel of stethoscope and inflate now. I will inflate now around 150 mmHg. Now slowly I will deflate the cup. So systolic sound I heard at 120. And diastolic sound I heard at 72 mmHg. Corticocope sound. Your blood pressure is systolic sound is 120 and diastolic sound is 72. So that is your normal. Thank you.
Hello everyone, my name is BOLLA TEJASVI. Today we will be discussing about physical examination, how to do physical examination, about how to measure blood pressure using a sphygmomanometer. So here we will be using two instruments, which is a sphygmomanometer and a stethoscope. Before proceeding to measure blood pressure, we should know that what is blood pressure. Blood pressure is the force through which blood travels all over the body. It is the pressure which is going against the walls of the blood vessels. Blood pressure is generated by circulatory system, which is heart. Normal blood pressure value is 120 by 80. 120 is called systolic pressure, which is the pressure when the heart contracts, and 80 is the diastolic pressure, which is the heart relaxes. Wash your hands before starting the procedure. Firstly, introduce yourself to the patient, check the position of the patient, and explain the procedure. The patient should avoid smoking, caffeine, or exercise for prior 30 minutes to the measurement. Examination room should be quiet and comfortable. The patient should sit quietly for 5 minutes in chair with feet on floor. The arms should be free of clothing. Palpate the brachial artery to confirm a variable pulse and position the arm so that the brachial artery at the antebrachial crease at the level of heart which is roughly at 4th intercostal space at junction with sternum. If brachial artery is below heart level, the BP readings will be high. If the brachial artery is above heart, the reading will be lower. Center the inflatable bladder over the brachial artery. The lower border of the cuff should be 2.5 centimeters above the antecubital space. Slightly flex the patient's arm at the end. Firstly, estimate the systolic pressure by palpation. As you palpate the radial artery with finger with one hand, rapidly inflate the cuff until the radial pulse disappears. Read this pressure on the manometer and add 30 mm of mercury. Using this sum for substitute inflation prevent discomfort from unnecessary high cuff pressure. It also avoids an occasional error caused by an oscillatory gap, which is a slight interval that may be present between systolic and diastolic pressure. Now deflate the cuff completely and wait for 15 to 13 seconds. Now position the diaphragm of the stethoscope over the brachial artery to measure the systolic and diastolic pressure. Now inflate the cuff again rapidly to the target level and deflate slowly, and add about 2 to 3 mmHg per second. Noting when you heard the sound of at least 2 consecutive beats, this is called systolic pressure. Now to continue to deflate the cuff slowly until the sound becomes muffled or disappeared. To confirm the disappearance point, listen as the pressure falls another 20 mmHg. Then deflate the cuff rapidly to 0. The disappearance point, which is usually only a few mmHg below the muffling point, provides the best estimation of diastolic pressure. Listen for the first quarter of sound and note systolic blood pressure. When the pulsatile noise disappears, note the diastolic blood pressure. The point at which the sound disappears is referred to as the fifth quarter of sound. Then note the diastolic blood pressure. Repeat the procedure at least twice. Average the result to give the final result. Thank the patient and then sanitize your hands.
Hi, how are you?
I'm fine.
I'm MONISHA. I'm second year medical student. I've been asked to examine BP today. Can I proceed with the procedure?
Yes.
Okay. Before starting, can I know your name and age, please?
I'm Shakya, 36.
I'll ask you some questions. Is that okay for you?
Yes.
Did you smoke?
No.
Did you have any caffeinated drink?
No.
Are any exercise before coming here?
No.
Let me explain the procedure. First, I'll take the cuff and surround it in your arm, but it will not hurt you. Is that okay for you?
Okay.
Can you place your arm on the table? Okay, that ends the procedure. Your BP is normal. It's 112/72.
Okay.
Thank you very much.
Hello, I am SRINIVASAN, second year MD student in University of Perpetual. He is Mr. Alex Taylor doing his MSc Psychology in American College. He is willing to check his BP. With his permission, I am going to check his BP. First, we are going to use a sanitizer to sterilize our hands. Sir, please, can you show your hands? Rub it nicely. Okay. So may I know your name?
Alex Taylor.
Your age?
24.
Recently, you had any caffeinated drinks?
Yeah, yesterday 4 p.m.
Yesterday 4 p.m. Pepsi. You had any vigorous activities in past 1 hour?
No vigorous activity.
No vigorous activities. Now I am going to tie the cuff in his right hand. Before that, I have to inspect his hand. His hand in the upper arm to the lower part, we have to see any lesions, skin lesions, any lymph edemas, any ulcerations, any scars, any recently started IV lines. His hand is very clean to check the BP. I am tying the cuff 2.5 centimeter above the antecubital region. It should be very firm, not too tight or not too loose. I have to inflate the cuff till the radial artery pulsation gets stops. For that I have to keep my fingers over the radial artery and feel the pulse. His pulse gets disappeared. So now I have to note the reading and deflate the cuff and wait for next 30 seconds. Now I have to inflate the cuff from where the radial pulse gets disappeared. From that I have to increase 30 mm of mercury higher, and I have to place the stethoscope diaphragm over the brachial artery. Now I am inflating the cuff. Now slowly deflating it. I am hearing the pulsation, which is the systolic blood pressure, and slowly I am deflating the cuff. Now the pulsation gets disappeared. This is called diastolic pressure. Now I am removing the cuff and informing the patient about his BP. Sir, your BP is normal, which is 120.
I am MURUGAN from Medicine second year. Prior to any appointment, the doctor should sanitize their hand properly and disinfect the required instruments properly. The lower edge of the cuff should be 2.5 cm above the antecubital crease. Secure the cuff snugly. Now I am going to palpate the radial artery with my fingers and inflate the cuff until the radial pulse disappears. Record the pressure on the manometer, and now I am going to inflate the cuff by adding 30 mm mercury to prevent the discomfort from the unnecessary high cuff pressure. Deflect the cuff completely and wait for 15 to 20 seconds. Now I am going to place the bell of the stethoscope over the brachial artery and inflate it again until the targeted level. Deflate it slowly at the rate of about 2 to 3 mm mercury per second.